You need a crown when your tooth has had, usually, it's extensive filling after filling after filling. So usually it's when a patient's a bit older and they have just deteriorated the tooth. There's so many parts and sides of it that have become weak, very thin, and sometimes there's fractures in the teeth. So when you have a situation like that and you need to continue to keep that tooth in their mouth, be it alive or it's had a root canal, which means it would be dead, either situation, if you need to support that tooth and give it that crown, which goes around and gives it a 360-degree support. If people call it a cap because it's like it goes around your head and all the way around that circumference. But it goes down and supports that tooth, so when you put function on it, that function goes down more evenly. It's not just like they have one part that's still good and that gets all the force. So when people come in and half their tooth's broken off, or we see this old filling with a fracture down the side, or a tooth's hurting and we discover it's a fracture that's causing that pain when they bite, we'll start with a crown and give them that, give them that strength back that they've lost. I compare it to when you go on the road and you see these little potholes and they fill those little holes back in. They last a little bit, and that's like a filling, I think. So like a little road that has a little pothole, a little filling, and then those come out again when it rains and stuff. And fillings have to be replaced more often than a crown, but when they come back and they repave that whole surface, you have this beautiful road to drive on, and it's strong and sturdy, and there's not going to be little holes in it anymore. That's how I compare a crown to kind of another analogy in real life. Just going to repave it, new strong surface, and it's good to go for a long time. I think crowns have the potential to last a lifetime.